Hi, my name is Achu and I'm a second year nursing student at Ontario Tech University, and this is my second critique video for pharmacology, and today I'll be demonstrating on how to administer subcutaneous and IM injections. So let's talk about IM injections. There's three potential sites on the body that you can use to administer these injections. The first one being the patient's outer arm. You can place your non-dominant hand on the patient's arm like so, and just locate the deltoid muscle by spreading your fingers and by having your index finger pointing towards the anterior part of the body and your rest of the fingers pointing towards the posterior part of the body. You'll be injecting the IM injection deep into the V, into the deltoid muscle. The second potential site is the ventrogluteal muscle. You're going to be palpating for the trochanter, and as you locate the trochanter, you're going to place the palm of your non-dominant hand on the trochanter and again spread your fingers. You'll notice that your thumb is going to be pointing towards the groin and your index finger pointing towards the anterior part of the body, and you can locate the ventrogluteal muscle and inject the IM injection deep into the V. The third potential site that you can use to administer IM injections is the vastus lateralis. The vastus lateralis is, again, you're going to be palpating the trochanter and locate the trochanter, and you're going to place your non-dominant hand. You're going to calculate one with hand above the patella and one with hand below the trochanter. Just locate it and place it in the middle again, and you're going to be injecting it in the muscle somewhere in between the anterior part of the thigh and the lateral part. Now let's draw the medication. For IM injections, you're going to be coming into contact with bodily fluids, so it's always safe to wear gloves before injecting them. So I'm going to put on a pair of gloves. Okay, I'm chosen a 3 milliliter syringe, and I have the appropriate needle on the syringe, and I'm going to withdraw from the medication vial, and after completing my calculations, I know that I can draw 1 milliliter of solution. So I'm going to remove the cap off the medication vial. I know this top part of the medication vial is sterile, but when I'm in doubt, I can always use an alcohol swab to clean it. Then I'm going to draw 1 milliliter of air into the syringe and carefully remove the cap and insert the syringe and needle into the medication vial while squeezing the air into the vial so I can draw the solution. You want to keep the needle in the solution to avoid air bubbles. I drew a little bit more than 1 milliliter. I want to tap out the syringe for the air bubbles, and I'm just going to squeeze the extra solution bit out so that I have 1 milliliter of solution in my syringe, and I'm going to carefully cap it back. So I'm going to drag it against the table and carefully cap it back. Now I'm in the patient's room and I still have my needle capped. I'm going to prep the skin by using an alcohol swab. When prepping skin, you want to avoid any necrosis, any damaged skin. You want to avoid blood vessels and nerves when injecting the IM injection. And you want to make sure that the skin is dry, intact, and clean. So I've prepped the skin by using my alcohol swab. And now, to properly landmark, I'm going to use the Z-Track and to insert the needle 90 degrees. So I have my Z-Track. I am removing the cap. I have my needle of 1 milliliter solution. I'm going to insert it into the skin 90 degrees. And I'm going to insert it and push down up to the hub. I'm going to let the needle aspirate. If there's blood coming back into the syringe, that means I know that I hit a blood vessel, and that's something you don't want. Now I'm going to count to 10 and slowly push down the syringe. The solution has been inserted. I'm going to carefully remove the needle, dispose the needle in the sharps container, and clean the site. And you would gently massage the site of injection for an IM injection. So that is how you administer an IM injection. Next, we have the subcutaneous injection. For subcutaneous injections, again, you have 3 potential sites that you can use to administer subcutaneous injections. The first potential site is the outer upper arm of the patient, right here. You would pinch the skin a little bit over here. You can use your abdomen from the costal margin towards, or in between the costal margin and the iliac crest. You would avoid the 5 centimeter diameter from the umbilicus, and you can also use the anterior part of your thigh. So now I'm going to draw the medication for a subcutaneous injection. I've chosen a 1 milliliter tuberculin syringe. As you can see, it's 1 milliliter. And I have the correct needle attached to the syringe. And after completing my calculations, I know I can withdraw 1 milliliter of solution. I'm going to be drawing the solution from an ampule. Ampules are glass, and when opening an ampule, you can use the alcohol swab wrapper and twist it around the neck of the ampule and break it away from you and dispose of it into the sharps container, so that you can avoid any glass shards in your fingers and you can always protect yourself. Okay, so after you do that, you're going to leave the ampule flat onto the table. You're going to carefully remove the cap of the needle, and you're going to insert the needle into the ampule. Okay, all right, be careful. You can even leave it flat. And I'm going to withdraw the medication into the syringe. Okay, so you want to again avoid air bubbles. You want to tap that out. As you can see, I have a stubborn air bubble. And be careful when tapping out the air bubble. Let's do that again. All right, I'm not very confident with that, so I'm going to insert the solution back into the ampule. Just so that I have the 1 milliliter solution. And yes, so this is a 1 milliliter solution, and I just squeezed out the excess. There's no air bubbles, as you can see, and I'm going to carefully cap back on the needle by pushing it against the table before walking into the patient's room. Now that I'm in the patient's room and I've picked my site of injection, I am going to prep the skin, all right, with an alcohol swab. All right, again, you want to avoid any necrosis, any damaged skin, any breakage, any bruises, any abrasions, and you want to make sure there's no blood vessels, nerves. You want to pinch the skin, okay? You want to bunch the skin a little bit before you insert it. You want to get a 45-degree angle. I'm going to carefully remove the cap, and I'm going to insert it at a 45-degree angle. There we go. And quickly insert the injection into the site. There we go. And slowly release the skin as you remove the needle and throw it in the sharps container. If you see any blood coming out, you can always use an alcohol swab to clean up the site. Thank you.